Yes, thank you so much. And Dr. Hugo, congratulations on these results and this extremely well-conducted trial. These are not easy studies to run, particularly in such heavily pretreated patients. So I think we've all been eagerly awaiting the results of this trial. As clinicians, we've seen how well and how dramatically sacituzumab govitecan works in triple-negative breast cancer patients. And as Dr. Hugo points out, these estrogen-positive, endocrine-resistant patients really are an area of great unmet need, and their cancers can be very difficult to treat. I think what we've seen here is that sacituzumab govitecan tends to work better than chemotherapy when compared. And even though the median progression-free survival difference, 5.5 months versus 4.0 months, may not seem clinically significant, it is important to look at those landmark analyses. A lot of patients on this trial had a lot of prior chemotherapy. 95% of patients had visceral disease. The median number of lines of chemo was 3 in these patients. And so a lot of patients, in both arms progressed quickly. But then when you look at the patients who do respond on the sacituzumab govitecan, it seems that they tend to respond better and longer. The idea that someone with such heavily pretreated disease could walk into your clinic and you could offer them an option that would allow them a 1 in 5 chance of still not having progressed at 1 year is really huge from a clinical standpoint. So I think this definitely will offer an option for patients, and this is what we need, incremental options, things that may be different or better than chemotherapy. So I think this really represents a step forward for the field. Congratulations.